Good morning, everyone. Welcome to our session on academic listening, focusing on a crucial topic in modern healthcare, transcultural nursing care. Today, we will sharpen our English listening skills while exploring how to provide sensitive and effective care to patients from diverse cultural backgrounds. By the end of this session, you will be able to define transcultural nursing, understand its core idea and key model, practice essential academic listening skills like predicting content and note-taking, and apply all this through practical case studies, while also boosting your relevant English vocabulary. Why focus on these two areas together? Strong English listening skill open doors to global nursing knowledge. Understanding transcultural care is essential for quality patient outcomes in our diverse world. Together, they allow us to truly hear and understand our patients, no matter their background, especially in the international context. Transcultural nursing, pioneered by Dr. Madeline Lindinger, is about understanding both the difference and similarities in how people experience health, illness, and caring across cultures. The ultimate aim is to provide care that respects and aligns with the patient's own cultural framework. This is Laninger's sunrise model. It helps us visualize the many factors from a region and family structure to technology and politics that influence a people's health belief and practice. By considering these two factors, we can aim for culturally congruent care. To discuss transcultural care, we need some key terms. Cultural refers to shared way of life. Diversity means the difference between us. We must avoid ethnocentrism. Thinking our way is best, and stereotyping, making unfair assumptions. Our goal is cultural competence. Academic listening in English, specifically about cultural topics, can be challenging. We need to handle different accents, distinguish main idea from details, understand how speakers structure their talks, catch subtle meanings, and take useful note. Simultaneously, let's look at some skills. Good listener prepare. Before listening to a lecture or presentation, look at the topic. What do you already know? What words do you expect to hear? Predicting the content helps turn your brain and makes it easier to understand what follows. When listening for the first time, aim for the gist or main idea. Don't panic if you miss some words. Focus on the overall message. The introduction and conclusion often state the main points, and repeat words are usually important. Once you have the main idea, you might need to listen again for specific detail. This means focusing on names, symbols, reasons, or examples. Knowing what you are listening for helps you catch this detail. Don't be afraid to listen more than once if possible. Effective note-taking is crucial. The key is not to write every word. Use keywords, your own symbols, and abbreviations. Organize your notes in a way that makes sense to you, like a mind map or Cornell notes. Focus on capturing the most important information. Let's prepare for a listening talk. Imagine we are going to hear a short talk about how different cultures express pain. First, what words come to mind? Good. Now, let's match these key terms together. The first one, stoic. Okay, let's see. Enduring pain without showing feeling. Number 2, expressive. What does it mean? Yeah, it's A, showing feelings openly. Number 3, non-verbal. It's met with D. Okay, D is not using words. This prepares us for listening. Let's move to the case study. Meet with the Mrs. Al-Farsi. Okay, she is a Muslim patient from Saudi Arabia. Read the key point about her situation. We will see issues related to gender, to religion, and family dynamics. Mrs. Al-Farsi is a 60-year-old Muslim woman from Saudi Arabia admitted for diabetes management. She speaks basic English. She seems hesitant to allow male nurses into her room. She refused meals during daylight hours. It is Ramadan. Her adult son insists on being present for all discussions and often answers for her. Now, in your group, I want you to discuss Mrs. Alpha's case. Listen carefully to your group members. Identify the cultural factors. Think about potential misunderstanding and brainstorm 3 sensitive nursing actions. We will share our idea in a few minutes. The key point is modesty gender, Ramadan fasting, family role like decision making. For the action, we need to assign female nurse, if possible, respect fasting. Adjust meal. Involve son, but also try to engage patient directly. This is an important thing. But however, in your group, you can have more of discussion about this case study. Okay, and please let me know. Submit some short writing from your group to our board in the online course for this topic. Our second case is Mr. Chen, the elderly Chinese patient. Key issues here include language barriers, communication styles, pain perception, and the use of traditional medicine. Mr. Chen is an 80-year-old Chinese immigrant admitted with heart failure. He speaks limited English. His granddaughter translates for him every time. He often smiles and nods, but rarely asks questions. He refused pain medication, saying it's not necessary. His family brings him traditional herbal remedies. This is his situation. Now for this activity, we will do some role play. The pairs, one of you will be the nurse and the other is Mr. Chen. The nurse's job is to listen and communicate effectively about pain and traditional medicine. The rest of us will listen and observe. Let's try a few pairs. Actually, you can work in pair and then can record a short clip. Okay, post it in the on our online platform and submit link into our topic on this online lesson. Okay, and then we will do it. We will do it together, and also we discuss about your role play and give the feedback. Then we can focusing on the active listening, use of interpreter, open-end question, and non-judgment approach. Very careful about this. To summarize, transcultural care is a must-have skill. We need to be self-aware and aim for competence. We have practiced key English listening skills today. Remember, the most effective care comes from combining active listening with the true cultural sensitivity. The most important rule: always ask respectfully, never assume. It's very important. Does anyone have any final questions about the academic listening or transcultural nursing care? Yeah, sure. If you have, you can always post and ask me. Here are some resources if you wish to learn more. Thanks you very much for your attention and active participation today. Please go on for this website. It's very useful data and many information for you to learn about transcultural nursing. Okay, see you in the next session. Bye.